Hi everyone, Miss Lerner here. I'm here to go over the remainder of the major disorders graphic organizer. I hope that these little screencasts have been helpful in trying to delineate some of the causes and symptoms of these disorders. Okay, so the last anxiety disorder we're going to talk about is post-traumatic stress disorder or PTSD. Okay, and the major cause of PTSD, as you can imagine, is trauma. Okay. So this trauma can be anything from, being in the military, being a victim of sexual assault, natural disasters, a pandemic, abuse, um, being there for the death of a family member, or, it even correlates with time spent in the foster care system. Um, just because you have a trauma, though, that does not necessarily mean that you are going to have PTSD. Okay. So, again, we talk about there being an underlying predisposition genetically or having some sort of brain abnormalities, and then that trauma being the trigger for the development of the disorder. Okay. So, what are some symptoms of PTSD? Well, really just kind of like a free floating state of anxiety, bad dreams, flashbacks, constant emotional and mental stress, difficulty completing tasks, holding a job. Sometimes we talk about triggers that incite flashbacks. So let's say you're in military service and the sound of a helicopter or an air conditioner just puts you right back there. Okay. And as far as emotionality goes, people with PTSD tend to have what we call flat affect or emotional numbing. Okay, that they don't really express their emotions particularly well, and PTSD actually is going to cause permanent changes in the brain in a specific area of the brain that is dedicated to fear and aggression, which is called the amygdala. All right, moving on to another type of disorder. Okay, we're going to talk about schizophrenia, which is sometimes known as a schizophrenic disorder, okay, or a psychotic disorder. Okay, well, we kind of throw around that term psychotic loosely, like, what are you, psychotic? In reality, what psychosis means is a break from reality. In some capacity, you are living in an alternate reality. Okay, so I am going to say that schizophrenia is a very, very genetic biological disease. Okay, it is present in up to 1% of our population worldwide. It is the only psychological disorder that spans every single culture. It doesn't have cultural bounds. So that indicates itself that it is going to be very much brain based and biological. Okay, so um, brain chemistry problems, especially we talk about an increase in something known as dopamine, environment or family disturbances, substance use. Now, substance use may trigger a psychotic episode because it is increasing that neurotransmitter dopamine. Okay, so the what we call the positive symptoms of schizophrenia, and in psychology, positive doesn't mean good; it means adding something that is irregular. Positive symptoms like delusions and hallucinations are going to be associated with too much of this neurotransmitter. Okay, so as I said, positive symptoms in schizophrenia are adding something that is irregular. Okay, negative symptoms are taking away something that's normal. Right, so the two major positive symptoms in schizophrenia are going to be hallucinations and delusions. Usually, when we talk about hallucinations, we think of it as just a visual experience. But a hallucination is any sort of false sensory image. It could be visual, it could be auditory, you can hear it, it could be tactile, you can feel it, olfactory, smell it, or gustatory, taste it. By far and large, the most present type of hallucination is auditory. Okay, people with schizophrenia tend to hear things over and over again, singular words or self-deprecating statements. They're coming to get you, that kind of thing. Okay, delusions are a little bit different. Delusions are not false sensory experiences; they are false beliefs, and very common pathways of false beliefs in schizophrenia are delusions of what we call grandeur or persecution. Okay, a delusion of grandeur just means that you think you're invincible, you think you are an exception to humanity, that you think that you can do things like fly and, um, you know, cure poverty and do whatever you think you can do. Okay. Persecution just means that you think that people are coming to get you, they're watching you, the government is trying to control you, and so forth. Okay. The negative emotions in schizophrenia are sometimes mistaken for depression. Um, the negative symptoms are going to be like a lack of emotion, some bizarre behaviors, what we call incoherent speech, like a word salad. Sometimes maybe you'll hear a homeless person speaking in what seems like nonsensical language, which we sometimes call a word salad. And that is going to be an absence of something that is normal. So it is a negative type of symptom. All right. So, just as a side note, schizophrenia is not the same thing as DID. Okay. Those two get confused all the time. Okay. Schizophrenia means split mind, it's not a split personality. Um, Dissociative identity disorder is what used to be called multiple personality disorder. And one of the reasons why schizophrenia and DID get confused so much is because of the way that they are presented in popular culture. A lot of times movies will confuse the terms or confuse the diagnoses and present the wrong diagnosis with the other disorder. All right. Moving on to autism. Okay. Autism is really a developmental disorder, a disorder of infancy or childhood, okay, because that is when it's going to appear. And autism is what we call a spectral disorder. Every single person who has autism it's going to look very different for them. Okay, so you can be very high functioning and have autism, and you can be severely autistic and nonverbal. Right. So, what are some causes for autism? Well, tends to run in families, some genetics, biological, environmental factors. We're not really exactly sure of what those are quite yet. Okay. Um, and one thing that we're pretty certain that doesn't cause autism, that is constantly pinned to cause autism, are vaccines. Okay. There's been no scientific study that has proved that autism is caused by vaccines. We do know that because it tends to be many more boys than girls affected, that it is going to probably have some sort of problem with the X chromosome. So girls are XX, boys are XY. So that means if you have a problem with the X chromosome and you're a boy, you don't have another X to make it up. Okay, so that's what is happening there. All right, so the major kind of trademark symptom pattern of autism is severe sort of communication and social difficulties. Okay, so they avoid social interactions, there's some communication issues, there might be a repetitive speech patterns and tics. Sometimes there are verbal and physical outbursts. They may have some sleep deprivation, difficulty with performing motor skills, limited interest on one activity, like someone who is autistic may have a very, very singular interest in trains or, a musical group and know every single thing about that item. Okay. Sometimes, and not all the time, but sometimes people with autism are going to excel at arts or math or some very, very individualized topic. And we call that a savant. Okay. That you're an autistic savant. All right. Moving on to the eating disorders. Okay. I'm guessing that you have been talking about eating disorders and health for years upon years upon years, okay? Because they are going to be a psychological disorder that is really, really associated with adolescence. But it's not just bound to adolescence. It can happen anytime in a lifetime. But hopefully we can talk a little bit more in depth about some misconceptions about anorexia and bulimia. Okay, so as far as causes go with anorexia, genetics again, environmental and social influences, especially in cultures where there's like a sort of society's push for an unrealistic thin ideal, um, an attempt to control their world. So anorexia tends to be associated with people who have OCD. Okay, because if you think about it, being thin is the obsession, and the compulsion is going to be the food, the restriction of food and food rituals, which we'll talk about in a moment. Um, an overwhelming concern with your appearance, certain activities like your participation in modeling, dancing, gymnastics, wrestling could also be contributors to being anorexic. All right. So, what is the symptom pattern of anorexia? Well, typically speaking, anorexia just means that you have restrictive eating patterns. I think it's a misconception, again, that people with anorexia don't eat food. They do eat food. They're just very restrictive about their choices. Okay. Significant weight loss, preoccupation with calories, knowing, the caloric content in every food. It used to be a diagnostic criteria that you had to weigh less than 85% of your body mass index. That is not true anymore. Okay, we have eliminated that, which is good because there are plenty of people who do not meet that criteria and then can't get the help that they need. Okay, and then anorexia is going to have pretty profound health side effects. So yellow skin, brittle nails, acne, loss of menstrual cycle in women, feeling cold, gastrointestinal issues, and what we call food rituals. Food rituals just mean that an anorexic may take a very long time to eat a specific item. They may, be very ritualistic about it. Take an apple and cut it into 50 pieces and eat it over the course of an hour, or do other things like dip their food in something that is unappetizing in order to eat less. Okay, those are food rituals. Anorexia is the most fatal of any psychological disorder. Okay. Another major eating disorder is going to be bulimia. Okay. Bulimia nervosa is going to have a lot of the same triggers as anorexia, but that being said, there's going to be some differences. Okay. So genetics again, stress, negative body image, any societal pressures again, a history of abuse, which tends to be common with bulimia, being in a profession that focuses on a physical appearance. Okay. People who are bulimic tend to be comorbid with two other disorders. First, bipolar disorder, which we've talked about last time. Okay. The second being borderline personality disorder. Now, borderline personality disorder we haven't talked about yet, but we will talk about next week or this week. It just is a disorder in which someone has a lot of trouble kind of managing their emotions. They do this push and pull thing with other people. I love you. Don't leave me. I hate you. Go away. They are prone to self-injury and other injurious behavior. Okay, so when we say comorbidity, it means that these disorders tend to occur together. Bulimia is a little bit different. Sometimes we say that bulimia is like a secret illness, because while many times you can look at an anorexic and know that something is wrong, a bulimic can and usually does weigh normal weight or can even be overweight, because purging is not really an effective way to get rid of calories. Okay. So what are some other kind of symptoms of bulimia? Well, bulimia itself is going to be, typically speaking, binging followed by purging, either through vomiting, exercise, or laxatives. Okay. Now, a binge is subjective. For some people, a binge can be a pretty normal meal, and for other people, a binge can be tens of thousands of calories. Okay. So, again, just like any of these disorders, there's going to be a big sort of continuum. Okay. So constant weight fluctuations, from if you're purging, in large weight glands, weight glands, sorry, that was weird, enlarged neck glands, broken eye vessels from purging, calluses on your fingers from purging, um, disappearing after eating a meal, constant weight fluctuations, and electrolyte imbalances, because all that throwing up, as well as if you're using laxatives, is going to really mess with your body chemistry, and it's going to be very dangerous. So, bulimia is going to be associated with a lot of cardiovascular events like heart attacks and strokes. Okay. All right. Body dysmorphic disorder. Okay. Body dysmorphic disorder is kind of going to be associated with the eating disorders, but it's a different class of disorder entirely. It used to be called a somatoform disorder. In reality, it's now called a somatic symptom disorder. Okay. That word soma means body. Okay, so essentially, a somatic symptom and related disorder is going to have some sort of psychological transfer from, the mental state to your body. Okay, so body dysmorphic disorder is going to be caused by low self-esteem, anxiety, depression, genetics, childhood trauma, again, social expectations through the media. It's usually going to develop during adolescence, because adolescents do encounter what's called the spotlight effect, which they think that everyone's looking at them, when in reality, people are more interested in themselves. Okay, so what is body dysmorphic disorder? So a lot of times it's not a psychologist that comes up that gives someone the diagnosis of body dysmorphic disorder. It's actually a plastic surgeon. Okay, because people with body dysmorphic disorder are obsessed with a perceived defect in their appearance. Okay, and it's a perceived defect. It's not necessarily true. Okay, so they could think that they have an enormous nose and keep getting nose jobs over and over and over again because they think that their nose is terrible. No plastic surgery is going to fix it if the problem is in your head. So we do kind of think that maybe this was what Michael Jackson had, okay, and other people who are addicted to plastic surgery. Okay. So extreme self-consciousness is another symptom. Isolation, dysfunctionality in terms of having a job or relationships because you isolate, because you don't want to put yourself out there because you think everyone's looking at you. Fixation on mirrors. People would think, oh, you have body dysmorphic disorder, you avoid mirrors. No, actually, they tend to fixate more on that defect. Okay. And then lastly, the last disorder we're going to cover, major disorder we're going to cover, is what is called dissociative identity disorder. Dissociative identity disorder is, again, what was used to be called multiple personality disorder, and it is by far the most controversial of the disorders. Depending on who you talk to and what mental clinician or psychological clinician you speak with, they will either really believe that this exists or does not exist. Okay. And one of the reasons why why it's so controversial is because the person who popularized this disorder, it was covered in this book and movie known as Sybil, came out and said that she was actually faking the entire thing. Okay. And they, and when you're a key person in kind of shedding awareness to a disorder says that it was false, it kind of lends itself to decreasing the credibility of that illness. Likewise, the other thing that's controversial about it is that, the symptom patterns vary so much among people with that diagnosis. And because of that, they are like, well, are people just making this up? But regardless, let's just assume it is a valid diagnosis. Okay. What kind of disorder is it? It is a dissociative disorder. Okay. When you say when you dissociate or it's a dissociative disorder, it means that in some way you are separating yourself from your identity or separating yourself from your sense of self. Okay. Generally speaking, people with DID are going to have, this is across the board, going to have a history of emotional, physical, or sexual abuse, specifically sexual abuse. Okay. And this tends to be something that is quite universal if you look at the literature and the case studies. Okay. What are some symptoms? Well, anxiety, depression. Um, and the major symptom is having one or more personalities that alternate control over over your consciousness, and we call these alters. Like if you've ever heard of the word alter ego, okay, your ego is yourself. Alter ego is this other sort of person that you become. And as long as you have, more than one, you would have DID. Now, there are people who supposedly have 30 and upwards. Okay. What else? Well, because it's caused by trauma, the flashbacks of the trauma tend to be a very prominent symptom. Blackouts and like unexplained lapses in time are very common because if you think about it, if I'm Miss Lerner right now and then I become an alter, Johnny, an 8-year-old, in I'm going to, when I go back to being Miss Lerner again, I'm going to miss all that time when I was my alter. Okay, so for a lot of people with DID, they just have unexplained injuries. Um, they have time periods that they don't understand where they were, and they're pretty confused. Okay, so I hope this sheds some light on the remainder of the major disorders. If you have questions, you want to check in, come to a live session. We're going to do personality disorders this week as well. Okay, so have a great day. Bye bye.